Hello, and welcome to the Aligned Modern Health Digital Doc conversation on fighting the winter blues. We are joined today by chiropractic physical medicine physician, Dr. Caitlin Hoff, and with licensed acupuncturist and herbal medicine expert, Dr. Shana Tully. Before we get started, we'd just like to introduce Aligned Modern Health and who we are, just in case it's your first time joining a Digital Doc webinar. Aligned Modern Health is Chicagoland's top-rated health and wellness service provider, providing expert care for the whole body. Through our integrative alternative medicine practices, we really aim to get to the root cause of why you're feeling what you're feeling, and not just look at one series of symptoms or conditions. We really customize our treatment plans to treat the whole person as an individual. We have 18 clinics in the Chicagoland area, and we also service patients in 8 US states via telemedicine. Our clinics are supported by several core practices. Our physical medicine practice includes chiropractic care, injury prevention and rehabilitation, athletic performance support, and clinical massage therapy. Our acupuncture practice is great for treating physical pain, but also for some intangibles like stress, anxiety, depression, men's and women's health and hormone balancing, fatigue, sleeplessness, seasonal allergies. This practice is also supported by some other modalities under the traditional Chinese medicine umbrella, like herbal medicine, cupping, and moxibustion. We round out our services with functional medicine and clinical nutrition, which is a really great way to look internally to better understand why you're feeling what you're feeling externally. We treat many gastrointestinal issues and autoimmune disorders, symptoms like bloating, constipation, fatigue, migraines. We work with men's and women's health and hormone balancing, food sensitivity diagnostics, weight management counseling, and nutritional counseling. This webinar today is being recorded, and all participants will be sent a copy of the recording after the presentation. We absolutely invite questions during the presentation, which you may type directly into the Q&A feature on your Zoom. That is the feature with the 2 little conversation bubbles. At the end of the presentation, we will address questions. Thank you again so much for joining us, and at this time, it is my pleasure to introduce Dr. Caitlin Hoff.
All right, hello everyone. I'm excited to talk to you guys about fighting the winter blues. Like Janine mentioned, my name is Dr. Caitlin Hoff. I'm a chiropractic physician here at Aligned Modern Health in our Andersonville locations, one of the 2 chiropractors here. So I went to chiropractic school at Palmer College of Chiropractic in Davenport, Iowa. And I also earned my Bachelor's of Science from Messiah University back in Pennsylvania. 2 of the certifications that I have are mechanical diagnosis and therapy, as well as Webster technique. So I really enjoy working with pregnant patients and also working with people of all kinds, athletes, non-athletes, and people just who are in pain.
Hi, I'm Dr. Shana Tully. I'm a licensed acupuncturist here at Aligned Modern Health in Andersonville as well, even though we work on different shifts. I'm the Tuesday through Saturday. Dr. Hoff is the Sunday through Thursday. What I studied was a doctorate in Chinese medicine. I've also taught at the college teaching herbal medicine points and nutrition. I also have an additional certificate in Chinese medicine dermatology and a Western herbal medicine background before going to Chinese medicine school. So I think today we're going to start off with talking about how in the wintertime we have this interplay in Chinese medicine in terms of yin and yang, in terms of light and dark. So when we're talking about the winter blues, we're talking about a lack of light. And that we can kind of look at it through the seasons of the year and how that light impacts us and how we change throughout the course of the year. So that always informs a lot of my choices going into the winter time as well. And so even when you're talking about, we just had the Lunar New Year and upcoming Solar New Year for in Chinese and other Asian traditions, as well as like even in my own Irish tradition, there's like a returning of the light tradition on February 1st. It's thought of as like Bridget's Day or St. Bridget's Day. So this sort of returning of the light actually is a great way to like actualize some of your New Year's resolutions that you haven't really been able to change yet. And I just want to give you the like input that like we've had this like agricultural, culture for thousands of years, and then all of a sudden we're supposed to be on 24/7 in this culture, and that's really a novel idea. So really have the energy of the year behind you to start bringing that life back really happens in February. So that for me, like what informs my choices for New Year's resolutions and things that I want to work on in January would be something like sleep. And that would be something that would positively improve my mood, but that I don't expect that like action phase to really occur until February. So if you're beating yourself up and that's one aspect of your winter blues, don't do it. It hasn't started yet. That energy is not there for you until the beginning of February. So in fact, my Earth School didn't even really start until February 1st. That was how like strongly my teacher believed in that. So when we talk about it, actually you can apply the stages of change. So there's this lovely slide called the stages of change, and part of the social work paradigm diagram. So really like December, January are like pre-contemplation and contemplation stages of change, or working on your sleep or stress reduction and really getting in that rest and preparation as well. And then the action stage, energy of the year, the light returning really doesn't start until February. So here you go. Like, it's okay. You can start now. But I know having lived in Chicago for 25 years, you're still like pretty like tired February, March, April. So just so you know, I mean, the energy's there even though the weather doesn't support it. And then really like going through the phases of the year, like you've got the energy, March, April, May, start making those active changes. And then maintenance phase really can be thought of as like summertime. And then, I love how in this social work model, they incorporate relapse into the stages of change. Like it's just a natural part of change. So you just have to go back on that same spiral in terms of change. So then getting back to like light and movement and action, I know Dr. Hoff wanted to talk about movement. So
yeah, absolutely. Yeah, so one of my famous sayings, and most of the people that I know also believe this too, is just movement is medicine, okay? And I really do believe that down to my core. Something that I like to talk to my patients about, or even just people in my life, is just trying to find 30 minutes of intentional movement per day, which can sound overwhelming to some people, depending on your activity level already. So for the people who are a little bit more active already, taking a 30-minute walk, or doing your mobility routine that maybe you've learned at Align Modern Health or somewhere else at your yoga studio or something like that. Whether it's a more intense workout, something like a run, lifting weights, etc., like that. For those people who are super busy and don't feel like they have 30 minutes to cut out, especially parents and whatnot with young children, totally understand that. So maybe separate bouts of movement, maybe doing a couple 10-minute walks here and there. If you can get up 10 minutes in between that meeting that you have, somebody who's sitting at a desk, maybe if you can take a walk around your building, something like that, break it up however that you can. But it also doesn't have to look like the traditional movement sense that I just mentioned. These things can be something like parking your car a little bit further away at the grocery store, or maybe before you're going shopping, taking the stairs instead of the elevator, cleaning. Let's be real, cleaning your house and your apartment, it does take a lot of work. It's a lot of steps, a lot of movements, squatting, bending, maybe lifting things overhead, those types of things. Also taking care of your kids. I already mentioned, those busy parents, like picking your kids up and off the floor, playing with them on the floor, crawling around, taking them to the park. All those things are movement, and it's a really awesome way to look at it. It doesn't have to be a workout. It can be just those things that are every day, and framing a new maybe mindset to it of like, this is intentional movement, good for me. And so if you're one of those people that likes to track data, checking in with your watch or whatever you have to track your steps. I always say 7,000 to 10,000 steps a day. Again, for somebody who maybe right now is only getting 2,000-ish a day, 7,000 might seem like a lot. So even if it's just, again, working on those 10 minutes of extra steps, those types of things, working towards a higher bit of a goal. So all of these things can be just as good for your mental health as well as your physical health. So, yeah.
That's awesome. And I love how you gave like super tangible goals. Like I know for me in January, my tangible goal was to like make sure I go to bed at like 9:30 and I wake up at 6 every single day so that like I have like a solid set of sleep and consistent bedtime, which can be really life-changing. And then like for you, like 10 minutes 3 times a day or 30 minutes, right? Like perfect.
Yeah. It's all about just incorporating, I think, a good routine, right? And then also not feeling derailed when that routine doesn't work out. That's another thing too.
Right.
So
right.
Not being discouraged, kind of like we talked about with the contemplation and change and going through that. And relapse is a natural thing. And so we just need to be kind of easy on ourselves sometimes.
Yeah, I know. And getting those endorphin going is like one of the best things ever in the middle of winter. So
yeah, absolutely.
And then I was going to add just like in terms of light and dark, the light boxes.
Yeah.
I have found like super helpful. Years ago, I used to work for a physician and we sold light boxes in our apothecary. And so I had to do a bunch of research on them. And I actually found an article, I'm going to put it in the chat, of like the New York Times has like a Wirecutter, they review products and they did do one on light therapy lamps. The main thing with light therapy is about dose and distance. So you want to have a light that is 10,000 lux within a certain distance. So you actually have to look up whatever one you're buying and make sure you're sitting close enough to the light for a certain amount of time. So a lot of them are 10,000 lux within 18 inches or 2 feet for 30 minutes a day. And it's best to do that like first thing in the morning or like no later than like 1-2 o'clock, because it does like actually suppress your own melatonin. And so you're going to be less likely to be able to fall asleep normally at night. And some people get quite, thank you. They get quite overstimulated by it if they have it on for too long. So that's an important aspect of things too.
Yeah, so I'm just going to jump in right there, Dr. Tully, talking about light boxes. So for people who aren't able to get outside, or maybe your routine just doesn't allow you to, depending on what time you have to get to work and that kind of a thing. But one of the things that I've looked into quite a bit is just direct sun exposure to the eyes within 1 to 2 hours of waking time. And so again, this could happen on your drive to work, that kind of a thing as well, if it does end up working out that way. But so what the standards are for this is kind of like Dr. Tully was talking about the dosage, right? So 10 minutes when the sun is out and there's no clouds at all. So the eyes directly getting exposed that way. And then also when it's cloudy, maybe even if there is a cloud cover, you're still getting sunlight exposure, but they say for about 10 to 30 minutes. So looking directly into that light, getting outside in the morning has been very well known to kind of increase those energy levels, wake you up a little bit, suppress some of that melatonin as well early through the day to get your energy moving. Yeah,
definitely. I mean, one or the other makes a huge difference. And I know for those super cold days where you can't stand to be outside, the light box is really handy for me. It's back in the back of the office, Dr. Hoff.
I know, I'll have to use it.
The other thing actually this year is a yin water rabbit year in Chinese astrology, which is interesting because actually to support that water aspect of the year and really kind of boost your overall energy, it's recommended that people do breath work. And it can be something really, really simple, like usually first thing in the morning, the time that's recommended is from 5 to 7, which is like, metal time. Metal nourishes water in Chinese medicine. So you want to do like something real simple, like easy to incorporate box breathing, which would be like breathing in 4 counts, holding 4 counts, breathing out 4 counts, and holding for 4 counts. That's a really simple one, easy to remember. So 4, 4, 4, and 4. That's why it's a box. Or you could do 4-7-8, which is like breathing in 4, holding 7, and then breathing out 8. There is also an app that has more advanced, if you're more interested in like really mixing it up. So it's called Insight Timer. It has a lot of free content. And yeah, I was looking to see if I could send it. I can't send it. I don't have a choice. I only have 3 choices. Anyway, so her assistant here will help us by posting it. It's called Insight Timer. You go to iTunes or Google Play and you just enter an Insight Timer, and they have a bunch of free content. They have a category called breath, and you can just go pop on there and pick your poison, basically. And they're about like 10 minutes long. But literally 5 minutes would be great.
Yeah, absolutely. And that's something that I love to work with my patients on too. And I'm sure Dr. Tully, you do too, is just, it helps with, first of all, relaxation and stress management, but it also helps with pain management too. So for those who are dealing with those types of things, those are the types of things that we educate on in our office, and both respectively, just differently in our own practices. So yeah.
Right. Yeah.
One of the things I was going to hop in and talk about was magnesium. Is that okay, Dr. Tully? Is that
Yeah.
work?
Yeah.
All right, awesome. So one of the things when we think about, I guess, relaxation, a mood booster, something like that, magnesium. It's one of the most abundant minerals in the human body, and it's part of 600 processes in the body. So I'm not going to bore you guys and go through every single one, but a few of the highlights that I would take away from magnesium just in general is it really does improve your energy levels and mood. It helps with your sleep, which obviously is going to help with that energy level, but it also is a natural reducer of cortisol response in the body. So cortisol is your stress hormones. So I'm sure a lot of people on this call, or just a lot of people in general right now, have very high cortisol levels. And so this actually naturally takes that level down, which can just reduce overall stress on the body. Obviously, like I said, helping with sleep, but also just reducing the stress, which means your body's just going to be able to function a little bit better. You're going to be able to handle stressors a lot better, the things that are thrown at during your day, environmentally, but also socially too, and then physically. It helps with the activation of vitamin D, which is, we'll kind of talk a little bit more about that. I think Dr. Tully is going to do that. And it's just really important to be working with a healthcare provider that can let you know if your magnesium levels are adequate or not, whether that's your PCP or maybe a functional medicine doc. I know that it is important to find that information out. But a few of the things I was just going to mention, just some foods that are high in magnesium for those who maybe do know or don't know that their magnesium levels are a little bit low. Things like spinach, bananas, cashews, as well as avocados, almonds, pumpkin seeds, fish, whole grains. So all of those have higher magnesium levels and could really benefit all of you guys as well.
Awesome. Yeah, I agree. I was just going to tack on the seeing your functional medicine doctor, your primary care, and making sure you have adequate vitamin D levels. I know for even musculoskeletal problems, especially chronic, we usually like to see those levels above 50, just to see a change in the myofascial tissue. So yeah, so that would be just something you can check in with your doctor with. But generally, yeah, we do recommend D3 as a supplement, especially in the winter time. And it's nice to have it be correctly dosed according to whatever your serum levels are. So I don't like to just randomly give away vitamin D.
Absolutely not.
Yeah. Pretty safe dose is like 1,000 to 5,000, but it's really much better if we have your serum levels. So you can make a free 15-minute consult with one of the functional medicine doctors, and they can run that for you pretty easy. And then other substances that we're thinking about, because we're turning back to plant medicine. I like to, whereas Chinese herbal medicine tends to be a prescription-based, in order for safe, correct use of those herbs, there are a number of things that we can kind of incorporate into our lives in the winter that have a long tradition of use as part of fighting the winter blues. Something as simple as the Earl Grey flavor, which is bergamot, actually has a strong effect on mood. Any citrus essential oil actually has an uplifting benefit to mood. So it's kind of a natural thing that I'm just drawn to drink Earl Grey every day in the morning, because it does actually, the orange, the bergamot flavor boosts my mood. Another thing that you'll see in the supermarkets this winter would be like a blood orange. Blood orange is also extremely uplifting for depression. It has this sort of mood regulating effect. And just by smelling it, tell yourself like, this is really good for me. And it has that rich red color, which is beautiful, full of like polyphenols, are really good for you. And then also like, going into something as simple as like a lemon balm tea. I'm gonna put that right there. Lemon balm is awesome for just like a general mood uplift in the wintertime. It's safe and affordable. You just buy this tea and make sure you steep it for about 15 minutes just to get the full benefit. It's relaxing, so it's better if you have it in the evening. It might be harder to focus. And then another thing that I think about too is that, St. John's wort has this long history of use in the winter for winter blues, but it does interact with a lot of medications. So I kind of switched over to using the flower essence. And even there's a flower essence with a topical oil that you can apply. So the flower essence is just drops you add to your water. It's made by Flower Essence Services, and it really does help like kind of make, in a very woo-woo way, like your etheric field more open to accepting light. So brightens your mood in that respect. But honestly, I'm always incorporating all this stuff into my day-to-day, whether it's like a little bit of like essential oil in a Epsom salt bath, or into my shower gel or something, a nice soap. But they're just part of my daily routine. It does provide a mild but moderate mood boost.
Awesome.
Yeah.
I really liked all that information. That was really good. Some new stuff for me too. So maybe I'll try some of that. One of the other things I wanted to talk about was cold exposure. So I think Dr. Tully and I are not going to agree on this one, which is fine. It's good to have different perspectives coming from this. That's why we do these types of things, so we can get different perspectives, right? So one of the things that I've been doing a lot of work with myself, but also with my patients, and even just researching a little bit, is that the benefit of cold showers upon waking. So again, this doesn't sound super attractive at first. Nobody wants to get out of their warm, comfy bed and get into a cold shower. Totally understand that. I know that I feel like, at least on my social media, it's been pretty present this year that cold plunges are a big thing, starting to make that appearance as with the health benefits that I'm going to kind of talk about here. It can release some of those really good feel-good hormones again, increase your alertness as well as your energy and focus in the beginning of the morning. And ultimately, it's just going to help with your mood. So they recommend 1 to 3 minutes of cold shower exposure. But again, if you've never done it before, even 20 seconds might seem like a lot. So like I mentioned, even with the steps, it's really just about gradual exposure, right? And so I know when I started that I really was only able to do 20 seconds of a very cold shower. But now, as I've done it more and started to practice a little bit more, I'm able to get a little bit over a minute. And it really has increased my energy levels as well as my mood. I just feel more awake and ready for the day a little bit better. So just another thing to maybe think about incorporating as well. But I'm going to have Dr. Tully kind of give her, perspective on the cold exposure.
Yeah, it's more of just a counterpoint. Like, we want people to do, personally, I prefer, if you're really trying to like stimulate that circulation, that you're doing like cold plunge and then following it immediately with like some kind of heat. And then kind of alternating it just to really like break through that blood stagnation and improve flow. But yeah, like it's not even just like Chinese medicine. Even like my friend who practices Ayurveda was like, I was putting cold water on my feet after the sauna, and she was like, "Oh, dude, you gotta stop that." So there are like, sort of long-term like historical contraindications for too much cold, but usually it's just like that alternation of hot and cold that we like to see. If you're going to utilize that, really does help. You were going to, I think, talk about saunas next, and I just wanted to like plug for circulation. If we're talking about saunas, is like King Spa has those like those exfoliation kind of people that'll do like a full-on exfoliation of your skin, like dead skin. That is the best thing in the wintertime. It's like I don't know, It's just so amazing. Anyway, so like speaking of a place that has saunas,
Right.
you talking about that?
Yeah, so sauna, again, like I said, cold exposure therapy, but also the warm exposure. So we're thinking about saunas, like Dr. Tully already said, warmth improves circulation, right? It promotes circulation. And so with sauna, sitting in a sauna can actually mimic exercise, just because it does increase your heart rate. You're in a hotter environment, your heart starts to beat a little bit faster, just in adapt to the environment that you're in. So it can be really good that way. It also can be good for detoxification. So getting that sweat out of just all the different toxins that we consume and that are environmentally with us as well. And then it improves your heart health just because it gets it pumping a little bit better, improves that circulation. It decreases the risk of infections, actually. It increases blood flow to the brain. So we already talked about that circulation again, just that good connection between mind and the body. And then also it can decrease inflammation as well. One of the newer studies that's coming out, it's great that people were doing it about 3 times a week, but actually when you see 4 days a week or more that someone is sitting in the sauna for about 15 minutes or less, it actually is linked to fewer symptoms of depression. So this was a really awesome study when it came out for me. It was really affirming for myself, but also just to share with other people. And it was really cool that kind of came across this as we were getting prepared for this webinar, getting to talk to you guys about this kind of stuff. And if your gym or if your home or whatever has a sauna, I would get using it just as you can. And also to get out of the cold too. It's good. It's a good way. Chicago can be pretty brutal. Luckily, we've had a good winter so far. So.
Yeah, I agree. Yeah, I mean, we were joking that one of our colleagues is going to go do the polar plunge in Lake Michigan, and I was like, you know what? There needs to be like saunas, just saunas, like up and down the beach, so that people can do that and then jump in the sauna right afterwards.
Yeah.
So, yeah, and then also the just to highlight the like cold and hot thing again. Just I found that the people who do the exfoliation and stuff, if you do the cold and hot, it kind of loosens your that like at the top layer of your epidermis, so that you can really release a lot and get more out of the saunas. That if you follow the saunas after doing exfoliation at King Spa. So yeah, I found it to be pretty clean there. So I had a question. Somebody just texted me. It was like, is King Spa pretty clean? And I found it to be quite good.
Awesome.
Anything else to talk about today? I think that's pretty much it. I guess, there was one other thing I was going to mention, that like there's this concept in Scandinavian countries called hygge, which is like means like cozy, comforting. So like in the time of winter, like really trying to embrace that principle and like really like cultivate that in my house. If I have to be stuck inside, like whether it's like electric candles or like mood lighting or soft blankets or cozy pillows or all of that, just really making your home into this really super cozy place so that it doesn't feel like you're shut in and you get like, like a fever in the middle of March where you're like, I can't stand it anymore. But like really the idea is that like, I know everybody in Chicago is like, I just need to go and like have a tropical vacation and I will be better. And yeah, that works temporarily. But if you really fix like your day-to-day habits and make winter more livable, like, bringing in some of the suggestions that we were talking about, it's really possible to like actually have a good winter here, like, and not feel like utter garbage. So,
Right.
because I know a lot of people do. So, and you will have some garbage days, but just pick back up, dust yourself off.
Thank you so much for this great information. I do think that brings us about to time, and we definitely want to address some great Q&A here. I invite everybody to go ahead and type your questions for Dr. Hoff and Dr. Tully into the Q&A feature. While folks are typing in their questions, maybe you can each just give us a brief understanding about how your own practices can help fight the winter blues. I know that our physical medicine practice can be really beneficial, especially if people are feeling some tightness or soreness in the body. And then acupuncture can be really amazing for some of those stress and anxiety and depression symptoms that we have as well. So to our participants, please type your questions into the Q&A feature. And while you're doing that, Dr. Hoff, why don't you start us off? Just tell us a little bit briefly about how your practice can help.
Yeah, absolutely. So when working on the physical medicine side of this, I see people who come in with different types of goals, especially around the new year here, that, you know, they're looking to get more active or looking to incorporate that new movement, or those things like I'm not able to play with my kids without pain, those types of stuff. So see a lot of that, and you know, and that can get you down and feeling the blue, those types of challenges that people face when they're in pain. And so we do a great job here of really evaluating those types of injuries, whether it's chronic, acute, so things that happened recently or things that have been going on for years. You know, we do a really thorough assessment, and we can really just try to bring the goals of your life outside of here into the clinic in here. And I love doing that through active rehab, as well as getting those joints moving a little bit better with our adjustments, and maybe even addressing some of the soft tissue complaints with our massage therapy as well. So when we combine all three of those things, you know, we can really get you back to some of those goals and get you moving a little bit better, give you things to be doing for a mobility routine and whatnot, just all tailored to your goals.
Thank you. And Dr. Tully, can you tell us a little bit about how acupuncture can help fight the winter blues?
Definitely. Whether, you know, we'll work to find the root cause of what's behind your mood changes, make any referrals if necessary, but also work on, especially in the wintertime, your overall like kidney energy, just improving that, because winter is kidney time. Working on helping you slow down, but also strengthen your overall resources so that your body, you don't feel like you're always running on empty or you're tired and wired, just like trying to calm everything down. And then also if you need to be built up herbally, we can work on that. Really depends on, it's very much customized to what is going on for you as an individual. So it's not something that's just like everyone gets the same treatment. I also want to add, just as a clarifying thing, that says other ingestible mood boosters, there aren't really that many foods that are particularly high in vitamin D, which is why supplementation is so important. Even like mushrooms are pretty low, but food like fish and animal foods can be somewhat high. Vitamin D is added to milk, but you know, the other things that were listed are actually not high in vitamin D. So like bergamot and lemon balm are just basically mood boosters. Kind of circulate qi, boost qi, uplift qi would be a way to look at it in the Chinese medicine.
Thank you for that clarification. We do have a number of great questions coming in. The first I'm actually going to address. We have several questions going back to the comments about magnesium and using supplementation versus some of the natural occurring foods, or foods that are naturally occurring, high occurring in magnesium. What we might suggest for the folks wondering about magnesium supplementation is to actually schedule a free 15-minute consultation with a functional medicine and nutrition provider. This is the practice that most closely speaks to this. And because you'll always want to better understand your own levels of any nutrient or mineral before you look to supplementation, because you may or may not need to, that's probably going to be the best route for some of these questions, asking about brands or what type of supplements or how much to take. Those are really personal questions, and you can give us a call or visit us online at alignedmodernhealth.com to schedule a free 15-minute consult with the functional medicine and nutrition team to learn more about supplementation. I just wanted to address that because it's a totally valid question, a great question, but it's something that really depends on your, your individual body and your physical makeup before we can answer something like that. So thank you for those questions, for those of you that asked about magnesium supplementation. We have a couple of questions going back to the talk about saunas. We have one question that asks about dry saunas versus something wet or a hot steam room. We also have a question to go over the recommendation for frequency and duration of time spent in the saunas. Dr.
Yeah,
Hall?
so I can touch base on the frequency first and then the duration. So like I said, 4 times or more per week is what they recommend, as well as about 15 minutes. So 15 minutes and then 4 times or more a week that we're sitting in one of those saunas. I personally don't have a preference between a wet sauna versus a dry. I've sat in both. I like both, and the study didn't actually differentiate between the two. I will say whatever's more convenient for you. If you can afford to get completely soaked in a wet sauna and are prepared for that, that's totally fine. I'd like to do my sauna sitting before I work out. So my gym luckily has a dry sauna. So I don't know, Dr. Tully, do you have any thoughts on the difference between the two, or not really?
I actually prefer a dry sauna myself, or an infrared sauna. But that's just, I don't like a bunch of damp air in my lungs. So if you have any kind of lung condition at all, like genetic asthma, it's not for me. But I don't have a specific clinical thought on that.
Speaking of clinical or perhaps counterindications, speaking about saunas continuing, is there any advice or guidance for people who may have had their lymph nodes removed? Is that anything that we might be able to address, or is that something better served with a free consult?
It feels to me more like a free consult.
Yeah, I would say more like a free consult. I'd probably have to ask a couple more questions just based on, where in the body and all of that kind of stuff. So I think I would refer to a 15-minute consult for one of our providers for that.
Thank you for that clarification. Dr. Tully, going back to light therapy and the link that you recommended, we have a question about, do they actually help? And if you can kind of reiterate how they might work to help.
Well, the important point is that it has to be used daily, and it has to be used at the correct dose, at the right distance, for the right amount of time, right? So it needs to be 10,000 lux within a certain distance. You have to read on your light's particular specifications. It might be 18 inches, it might be 2 feet, and it needs to be about 30 minutes. So if it's any less than that, you're talking about a longer time in front of that light. So say it's like 5,000 lux at 3 feet, you've got to be in front of it for an hour. So you might want to have it by your desk. But yeah, it's all about dose and frequency. Like if you're not doing it every day, then no, it doesn't work. You can supplement with being outside, walking outside and getting that sunlight. That would also be an equivalent dose.
And just a reminder for the doses on that, we're 10 minutes with direct exposure to the sun, and then also 10 to 30-ish minutes when we're looking at a cloud-covered sky. Just a reiteration on that.
Excellent. Thank you so much. Any thoughts on different salt baths or benefits from adding maybe mood boosters to a bath?
Yeah, I have a lot of thoughts on that. Well, one, like Epsom salts are made with magnesium. So you can just go back to the whole thing about magnesium and all the good things that it does for you. It also is a nice detoxifier. And then I always do like my 2 cups of Epsom salts, and then I put my essential oils in a bowl directly with that, or like an old yogurt container is good too. And you just mix them up together and then pour it in the bath once the bath is drawn and fully ready for you to get in. So you don't lose all the essential oils while it's filling up. But yeah, that's where you can put your citrus oils. Things high in limonene can be really good mood boosters.
Thank you so much. I think we have time for one more question. And I think it's something that probably a lot of folks are thinking in the back of their brain during our conversation on cold and hot, going back and forth between cold and hot. A lot of folks have, been taught for years that will make you sick. Having kind of a cold exposure, or especially going in and out of hot and cold places. Can you dispel that or give your thoughts about kind of the old wives' tale about going out in the cold or alternating between cold and hot actually making you sick?
Well, it's about time in history that we retire the term old wives' tales, because I find that it's demeaning to women and women's wisdom that has been passed on from generation to generation. But I also think that, I think we should be having a conversation about traditional wisdom with the scientific viewpoint and have that discussion, because that's ripe with so much good information. So with Chinese medicine, we talk about cold getting lodged in the body and causing symptoms. It's certainly something that we see. It's certainly something that can cause pain and discomfort and problems, whether it's like something very obvious in the Western sense, like frostbite causing very severe pain ongoing in fingers and toes, to like Raynaud's syndrome. That also can be a treatable thing that we use with, not surprisingly, warming herbs that help really invigorate circulation and clear cold from the body. So no, it's not an old wives' tale. I don't want to use that term anymore, but like there is some basis in tradition, and actually it is a useful way to look at herbs that have to grow in the same environment in which we are living. So like herbs actually have to defend themselves from cold too. So that's why there's that conversation. It's a very effective way to apply and use herbal medicine in a very like profound, life-changing type of way.
Thank you. Dr. Hoff, any thoughts about that from the physical body standpoint?
Honestly, Dr. Tully really took it from a different perspective of that. I mean, I don't want to debunk it necessarily. I think sometimes when we go out into the cold and we have cold hair, it's not necessarily, or wet hair, it's not necessarily great for us, but I think we've proved that it's more about your immune response than anything. And so, your viral load and these types of things when you're exposed to viruses or bacteria, that kind of thing. So, like I mentioned, just sauna therapy does improve the immune system. It can help fight off infections with the hotness of that, and then the alternation. I haven't really had any trouble with that, so that's where I'd be on that.
Yeah, definitely. Like the surface, right? Like how does the surface respond to temperature is actually a very pointed focus in Chinese medicine. So yeah, it does, and you can actually like change and transform like somebody's cold or flu like in a day. So yeah, it's a thing.
Thank you both so much for joining us today. Thank you to all of our guests that have joined us on today's webinar. That does bring us to time. Again, a copy of the recording will be sent out to all who have registered. And so if there are any key points during the presentation that you'd like to review, you will have a chance to do that. If you have any additional questions that were either unanswered or you didn't feel comfortable asking in front of a group, you are very welcome to schedule a free 15-minute consultation with any of our providers by calling 773-692-6700, or you can visit us online at alignedmodernhealth.com. The next Aligned Modern Health Digital Doc webinar will be on Thursday, February 9th at 12 o'clock Central. And that topic will be on heart health in recognition of February being Heart Health Awareness Month. Thank you so much for joining us. We really appreciate your time, and we hope you found the information beneficial. Have a great day.